Hi, everyone. Well, skin bleaching is a real challenge, and it's more common in Africa, in South America, in the Middle East, as well as Asia. And it's something that we've been really battling with for a long time. Again, it's, the psychosocial political issues related to it. And most of the time, it's also political because patients, there's an impression that if you have got lighter skin, you're much more attractive, more appealing, and the opportunities of getting work are also increased when you've got lighter skin. So it's a real challenge. And what is even scary recently is the fact that cases of squamous cell carcinoma have been reported, particularly in West Africa. A colleague of mine, Professor Fatimandi, has shared some really terrible cases of squamous cell carcinoma occurring on the face and on the neck in patients who've been using up to 8% hydroquinone. We did a study here in South Africa to look at the prevalence of skin bleaching, and we found that 35% of the patients used skin lightening creams to change their normal skin tone. And what's interesting here is that 70% of them actually did have legitimate reasons for using creams to treat pigmentation, because we need to know that patients with skin of color tend to heal with pigmentation, or what we call post-inflammatory hyperpigmentation after acne, that is pimples or eczema or psoriasis, or any of the inflammatory conditions like lichen planus and drug eruptions. And therefore, it is something that we need to consider in our treatment armamentarium. However, the issue of skin bleaching remains a challenge. The ILDS has come up with a position statement under the leadership of Professor Henry, and everyone is really keen to try and address the problem. And in addition, lately, we've been having a problem of abuse of topical corticosteroids. Corticosteroids are used to treat legitimate skin conditions like atopic eczema and other inflammatory conditions. However, because one of the side effects of topical steroids is lightening of the skin, so the consumers use this aspect of topical steroids to lighten the skin. And that also comes with a lot of side effects. For example, you can get steroid-induced acne, rosacea, thinning of the skin, permanent stretch marks, excessive hair on the skin or wherever this has been applied, as well as thinning of the skin. So of late now, it's been really alarming that the cases of fungal infections, which are resistant to the normal antifungals that we have also come up because of the long abuse or chronic use of topical steroids. And of course, as I mentioned, that one of the side effects of using topical steroids are skin infections ranging from bacterial infection to parasitic, as well as fungal infections. Fungal infections being more common. And another condition that we also see, particularly with the use of hydroquinone and mercury, is ochronosis, involving the areas where the hydroquinone has been applied. So these are all challenges, but I'm very excited that we are, with the ILDS, got the support of the board to embark on a global advocacy against skin bleaching. And this advocacy is going to include anthropologists, historians, psychologists, patients, dermatologists, marketing people, because we have to find a way of educating the consumers about the dangers of skin bleaching. We also need to change the mindset, particularly amongst men, because I believe that in West Africa, some men tend to be attracted to women who are lighter in complexion, and also there's pressure for women to actually lighten their skin. And I think because they don't know about these complications and side effects, it's something that we also need to change the mindset of the men and show them that actually having melanin is actually a good thing, because if you are dark, if your skin color is dark, you have a natural sun protection factor of 15, and that protects you from skin cancer as well as aging. So people who are dark pigmented tend to age much slower. So you'll find that someone is 60 years, but they look like 50 years old. So these are the messages that we need to convey to the consumers, that actually having melanin and being darker is an advantage to your skin. And there's a reason why people in Africa are dark, because it's very hot. The ultraviolet ray damages. So it's an evolutionary actually advantage. So these are all the issues that we need to address to the public. But I think we feel that as dermatologists, we have tried with advocacy, but now we feel very strong, and we're aggressively going to address this issue using multiple experts, multiple platforms, until people realize that actually black skin is beautiful and black skin is advantageous in terms of protection against skin cancer and aging.